Guys, if you just want to turn to page 25 of your manuals, we're just going to go through the final video series on lifestyle and nutrition. And like I've mentioned before, as personal trainers, we can prescribe exercises to our clients and we can program for them, but we cannot prescribe diet plans or give them nutritional advice. But it's important that you arm yourself with enough knowledge on the topic, so if your client does talk to you about it or does ask you some questions, then you can kind of fill them in some of the areas that they might be missing. One of the most important ones, and chances are your client would have read a lot of these anyway, is you really want to make sure your client is following the kind of correct food preparation guidelines. During pregnancy, your client's immune system will be lower, so the chances of catching a food-based bacteria does increase. So the chances of catching Listeria or Salmonella increases, so you really want to make sure your client's aware of that, so she's avoiding eating foods that carries that risk. So taking away kind of deli meats or salads that have sat there for a long time, and there's some kind of unpasteurized cheeses that carry those risks. So just highlight to your client that that still is important. There still is a danger in Australia. So if they do catch one of these conditions, it can lead to the baby being born still. So encourage your client to kind of make sure she's got an overall healthy diet without risking herself. You want to really encourage avoiding alcohol and caffeinated drinks. Obviously, these two things are toxic to the body, so eliminating as many toxins as possible will benefit the child and benefit the mother. So just again, highlight the importance of just eliminating alcohol through the diet. If your client is a big coffee drinker, one coffee a day or one caffeinated coffee a day is plenty. Any more than that is deemed risky for the baby. Just as I'm sure you will do for most of your clients anyway, but you really want to kind of preach, you want to minimize as much sugars, as much trans fats as possible. Again, there's plenty of studies that we've spoke about before where if your client is eating junk food, the chances of the baby being born with an addiction to junk food greatly increases. So just really encourage more organic, healthy lifestyle, moving away from those processed foods, those junk foods, those takeaway foods. You're doing them a good favour. In terms of prenatal vitamins, you really want to encourage your client to speak to their healthcare provider about which ones to take, if they should take one at all. Chances are most women struggle to hit all their values in vitamins and minerals that they need, so having a prenatal vitamin is a fantastic way to ensure they're hitting all their levels of kind of folate, vitamin C, vitamin D, calcium. They all need to be slightly raised during pregnancy. So these prenatal vitamins just make sure that she's hitting all her values and she's doing the best she can for her and her baby. Obviously sleep is a massive important factor. In an ideal world we'd all be sleeping 8 hours a day, but just make sure if your client if she's getting 8 hours of sleep, it's going to be good for her recovery, it's going to be good for her state of mind. And chances are when she's had the baby, she'll be struggling to sleep at all. So really just highlight the importance of sleep, highlight the importance of just her being as relaxed and as healthy as possible. A couple of things that aren't on here but that you might want to write down now is calorie consumption. It's a big question where clients will ask me exactly how much can I eat every day, is the myth, like am I eating for two, can I go and eat a cupcake every single time I train? The truth is there's a lot less calories than kind of most people think, so it's important to be aware that you're giving your client the right information. As a rule of thumb, in the first trimester, your client should only really be eating an extra 300 kilojoules a day, which obviously isn't much. In your second trimester, you're looking around 600 kilojoules. Your third trimester, up to 900 kilojoules. And if they're breastfeeding and postnatally, your client can get anywhere between 2,100 and 2,600 kilojoules per day extra. And that will just make sure they're not eating too much, but they're getting enough nutrition to fuel them and fuel their baby's development. As well as that information, you might want to write down a little code or a little equation to make sure that your client's drinking enough water each day. If you take your client's weight in kilograms, so kg, and you want to times that by 0.03, and that equals litres. So that basically explains, as your client is getting bigger, as she's getting heavier, her demand for more water is becoming greater. So during pregnancy, during the first trimester, she'll be drinking less than by the time she gets to the end of her third trimester. So use that equation with your clients, guys, to make sure they're drinking enough Plus, as Roscoe would have said earlier today, every time they are exercising with you or on their own, every 30 minutes of work they do, they want to increase their water consumption by 500 millilitres. So again, just highlight the importance, sleeping, eating and drinking, and they'll have a safe pregnancy. Thanks guys, and over to you.